Slept at
Oh, happy birthday,
1:30
belated.
yesterday.
Belated.
So we had a party at
Hello, hi everybody. I'm Dr. Sujata
hello,
Nair from Anatta University. Hello, sir. And
hello.
for those who are joining us for the first time, Anatta is a residential alternate life therapy program for those suffering from addiction to alcohol, drugs, or prescription medication, including the families of those affected by them. We are a single client program which is completely voluntary, non-medical in nature, and we use varieties of alternate therapies in the treatment process. We, through our channel Anatta Speaks on YouTube, are creating a process wherein we can widely share the awareness about addiction and its effects on different systems of the body. Currently, that is our project. And also, we provide the right solutions for the problem that is existing. The problem is known to everybody, but awareness of the right solutions is not there out there. So we are in the process of creating that. So in that same process, today we are talking about addiction related effects on the kidneys. And for that, we have eminent nephrologist Dr. Arun Shah with us on board. Dr. Arun Shah is an MD in nephrology. He is attached to Lilavati Hospital, Bhartiya Aarogya Nidhi Hospital, and the Hinduja Boutique Hospital, which is in Khar in Mumbai. He has received several awards regarding the same in his field, and he's also spoken on national and international platforms on nephrology related subjects. Dr. Arun Shah, hi. Good
Thank
morning and
you.
welcome to
Hello.
Anatta.
Very good morning. Very good morning, Sujata.
Yes, doctor. Can we start
Yeah.
without a delay?
Yeah. Yes, we can start. Yeah.
All right, doctor. So, what I wanted to know, doctor, is like you have had a very wide experience in treating people with kidney diseases. So, have you come across patients who have been afflicted by addiction to alcohol or drugs or prescription medication in your practice? Could you share on that, please?
So, when a patient asks what are the preventive measures we should take to prevent progress of the kidney disease, there are few things are in the hands of doctors, like controlling sugar, controlling blood pressure, and controlling cholesterol. But after these three things, the next work comes from the patient himself. Our next advice is to stop tobacco and stop alcohol. So why alcohol? More than two drinks every day and more than 14 drinks for males per week will call as chronic alcoholism, and for females more than 7 drinks per week is called as chronic alcoholism. And there is another entity called as alcoholic binge, where on a single day they drink more than 4 drinks and they come with injury to the kidney. Now, why the kidney is affected in alcohol? When you take alcohol, you dehydrate yourself. And when you dehydrate yourself, the whole mechanism of kidney is fluid and electrolyte balances. And when you dehydrate repeatedly to the kidney, there is a damage to the kidney. With alcohol, you tend to smoke. That also aggravates your kidney injury. You tend to eat a lot of starters or chutneys, what they call it. They are all loaded with salt. So that also will contribute to your hypertension on a long-term basis if you are taking alcohol regularly. So once you advise a patient to stop alcohol or reduce the quantity to a significant effect, what happens is that blood pressure comes under control and further damage to the kidney is prevented. You can't reverse what has already happened, but you can slow down the progress of kidney disease, and you can have a disease-free life for a long time.
Right. So, what you're saying is that the alcohol aggravates whatever existing disease is there in the kidneys. But,
Yeah.
doctor, can excessive addictive use of alcohol create any kind of kidney diseases also, or systemic illnesses related to the kidneys?
Yeah. So there are three things which happens. The chronic alcohol use will, you will develop hypertension, and that hypertension in turn will damage your kidneys. Then the chronic alcohol use will cause liver damage, and liver damage, once liver fails, it can cause kidney failure. And
Right.
it also can affect your heart, causing alcoholic cardiomyopathy, then the heart pumping fails, and that in turn will cause cardiorenal syndrome. So it is not only alcohol causing direct effect on the kidney, but there are so many indirect effects also through liver and through heart also. So any chronic alcoholism would always affect the patient, and it will deteriorate their kidneys on a long-term basis. A single alcohol intake will not affect kidney unless there's a binge. But chronic alcoholism, well, with different mechanisms, will damage the kidneys, which is irreversible loss.
Right. Thank you, doctor. That was quite enlightening because most people who consume alcohol, even on a regular social basis or excessive addictive use, are not aware how it affects the kidneys so much to even many times life threatening situations, life threatening extents that are happening. So, coming to another very important aspect of today's life is that people have a lot because of their lifestyle. A lot of lifestyle ailments come in because, like joint pains or body aches and all that, and people just pop in NSAIDs or painkillers or anti-inflammatories, as you call them.
Yeah.
Many times they also get addicted to these anti-inflammatories. So, how does excessive use of NSAIDs or what so-called anti-inflammatory medications affect the kidneys, doctor?
So I will divide this into two parts. One is analgesics and another is NSAIDs. So somebody who has a chronic joint pains or backache, they used to take a lot of analgesics drugs. Now all analgesic drugs will have either caffeine or codeine, which is addictive. So they keep on popping it up. And as a painkiller, they have aspirin plus phenacetin or acetaminophen or paracetamol. Now, caffeine and codeine will cause you addiction, so you tend to take it every day. Aspirin in that analgesic drug will cause glutathione deficiency in the renal papilla. And when it causes that glutathione deficiency in renal papilla, and if there is another phenacetin or acetaminophen or paracetamol combined in that drug, then it will cause papillary necrosis of the kidney, and then will cause chronic interstitial nephritis, and that's how it will damage the kidney on a long-term basis. And if this patient consumes a lot of analgesics for 2 years, 3 years, 5 years, over a period of time, you will see that on sonography, their kidneys have become small, irregular, and there are calcifications in the medullary region. So this is classical presentation of analgesic nephropathy. Now you opened up a can of NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs, commonly known as Voveran, Combiflam, piroxicam, COX-2 inhibitors. Now, these NSAIDs have a different mechanism of action, and they cause kidney damage. They cause acute interstitial nephritis, and it will cause vasoconstriction of the renal vessels. It's not the main renal vessel which becomes constricted, but the small capillaries which supply blood to the kidney, they become vasoconstricted. Then there is worsening of hypertension because of NSAIDs. Then there is electrolyte imbalance, like they can develop high potassium level in the blood, they can develop low sodium levels in the blood, they can develop swelling, fluid overload, and they very rarely, some NSAIDs, if you use chronically, they are also attributed to renal cancers also. Now, NSAIDs per se, we, in our nephrological terms, we say that it can cause acute tubular necrosis, acute interstitial nephritis, it can cause MPGN, it can cause nephrotic syndrome, it can cause membranous nephropathy. So, presentation in a different form, but ultimately the affection is of the kidney. And a patient who is elderly, diabetic with hypertension, and you have taken unsuspecting NSAIDs for 5 to 10 days, the doctor has prescribed you for 5 days for your joint pain or backache, and you continue to take it for long term, then you are surely inviting kidney failure, and it will be an irreversible kidney damage to the patient.
Thank you, doctor. You have used a lot of medical terminologies, but putting it very simply, analgesics are painkillers and NSAIDs are anti-inflammatory
Inflammatory
medications.
drugs, yes.
And these two drugs and these two medications, which are prescription medications, but also available over the counter,
Over
hence
the
people are
counter,
more
yes.
prone to popping them without considering the implications and the consequences. And you have put it forth very beautifully that it can cause, basically what they do is inflammation first of the kidney,
Yeah.
tissues of the kidney, which result in various ailments related to the kidneys, and that ultimately it is toxic. They are all toxic to the kidneys, and they ultimately result in failure. So those who
Correct.
are addicted to these anti-inflammatory medications and also painkillers need to be very, very aware that even like if they have comorbidities like diabetes, etc., they can come down with kidney failure even in a span of 10 days time.
Yes.
That's what I've
Yeah.
understood. Thank you, doctor, very much. And along in a similar category of anti-inflammatories and analgesics comes antibiotic use. And
Yeah.
especially in the current COVID times or with any kind of fevers or infections in the body, people also tend to buy antibiotics over the counter and eat them indiscriminately. How would you advise people in this context, and what can be the implications and consequences of the same on the kidneys?
So, Sujata, an antibiotic course for 5 days or 7 days, when prescribed, normally would not harm the kidneys. But
Right.
suppose if you are a diabetic, and there are a lot of patients in our country who take the drugs across the counter, doctor has given one's prescription for something, they keep the prescription home, and next time when they are sick, they go to the chemist and buy the drug by themselves. Now, suppose I will give an example. Somebody is a diabetic and he has been given in the past ciprofloxacin for his urinary tract infection. Now, this is a very fine drug for a short-term use. But a diabetic with a kidney disease, when they take ciprofloxacin, their sugars can suddenly drop and they can have acute interstitial nephritis and rise in creatinine. Similarly, all the drugs like ceftazidime or amikacin or gentamicin injections, which are aminoglycosides by the group. Now, any patient who has even minimal kidney disease because of the diabetes or hypertension, and if they take these injections without checking their creatinine or without advice of a proper doctor, that creatinine can suddenly rise. So these are the issues with patients who are diabetic and hypertensive and those who already have underlying kidney disease. Now, patients, when they take certain safe drugs like doxycycline or ampicillin or amoxicillin, there is no issue if they take it for 5 to 10 days. But they should not repeat the same drugs without consulting doctors for the next illness. They should always check their diabetes status, their kidney status, and then consult a doctor and then start their antibiotics. So, oral antibiotics, except for ciprofloxacin, we are not worried much. But injectable antibiotics, which are given but in nursing homes or in family doctor's practice, when suppose somebody is a diarrhea, vomiting, the gentamicin, amikacin is freely given. And I would say that this is very dangerous and it can precipitate acute kidney failure, on a basis of an existing kidney disease, and you can come in a big trouble. So antibiotic use across the counter should be avoided. You should consult your doctor before taking drugs, and all aminoglycosides, whether it is in family physician's office or a consultant's office or a nursing home or a hospital or in a critical care setting, should be used very judiciously to prevent the kidney damage.
Right. So thank you, doctor. That was very greatly and very nicely explained across. I'm sure people who are watching would have gained a lot from this answer. Doctor, coming back to addictive use of substances, how would you say, can we hear of people getting a lot of kidney stones nowadays? So those who are addicted to drinking alcohol or taking any kind of substances, how does alcohol create kidney stones? Does that happen, and what kind of stones would you commonly see?
Uh, See, alcohol in a smaller quantity would not cause much problem, but those who are chronic alcohol users, and if they are dehydrated chronically, and if you have a tendency to form stones, then you will precipitate stone crystals and a stone formation. But alcohol per se, if you say causes stone, no. But
Right.
alcohol with a long-term use can raise your uric acid. And if you have tendency to form uric acid stones, you will definitely form uric acid stones. Now, there are certain conditions, where if your fluid intake is affected because of your chronic abuse of substance, then also you can form stones. But that is on a long-term basis. On a short-term basis, if you drink a glass of wine or a glass of beer, you will not form a stone. But it's chronically dehydrated state where you remain stuporous, and if you have tendency to form stones, then you will form stones.
Right. Thank you, doctor. So, because we have seen a lot of our clients coming down with gout, and that is because
Yeah.
of excessive uric acid in the
Uric
body.
acid, yes.
Yes, coming down with kidney pains because of renal
Then,
stone
yeah.
formation, because of the
Yeah.
addictive drinking that has happened,
Yeah. Yeah.
etc. So, we have seen a lot of this happening amongst our clients. So, your answer was quite enlightening, doctor. Tell me something, doctor. What about the effects of illicit drugs? Like, have you seen like cocaine or MDMA or crystal meth? Have you seen people consuming these coming to you? You have found out as an aftermath that they have been using these substances when you have seen the damage to the kidneys, and it reminds you, and it comes to you that, oh, this is because of cocaine use, or this is because of crystal meth or MDMA use. Could you elaborate on that, please?
So, Sujata, it is quite surprising that sometimes we fail to understand why the kidneys of this person has failed. He neither had hypertension, neither had diabetes, neither had some drug abuse like Nsaids or analgesics or infections or glomerulonephritis. At that time, in a younger population, our antenna should be up, and you should be quite uh, worried why the kidneys have failed. But if you don't ask the question, are you addicted to the drugs, you will miss the bus completely. Now, it has been shown that in developed countries, almost 1 to 3% of population has taken cocaine sometime in their lifetime. And how many of them are chronically cocaine abuser, we don't know. The different country-wise statistics are different, so we don't know the details. Now, what happens when you take cocaine? Now, it's a worldwide recreational drug, and it causes sympathetic nervous system excitement, activation, and which in turn will cause intense vasoconstriction. It will reduce the blood supply into various important organs of the body. It will cause endothelial dysfunction. The cells lining the vessels, the endothelium at various places in the body, they become dysfunctional. There is the increased oxidative stress in the body because of cocaine abuse for a long time. There is a platelet aggregation, and there is a decrease in prostaglandin and prostacyclin. Now, what happens because of this in the kidney? Because here we are talking about the kidney disease. Now, when somebody is taking cocaine for a long time, kidney has four important structures like glomerulus, the clear tubules, the vessels, and the interstitium. Now, all these four areas of the kidney, because of the intense vasoconstriction of the capillaries, are affected. And when it affects the glomerulus, it will cause atrophy of the glomerulus, it can cause sclerosis of glomerulus, and there could be increased mesangial cell proliferation. When it affects the vessels of the glomerulus or the capillaries, it can cause capillary rupture and it can cause capillary thrombosis. And in tubules of the kidney, it will cause interstitial inflammation and necrosis and tubular atrophy, and also causes fibrosis and hemorrhages. So all these, when it happens chronically, then it will cause damage to the kidney, and this person's kidney fails over a period of time. Now, there are incidences where if somebody takes cocaine for one time and suddenly he presents with acute kidney failure. So these are also cases which we have seen in our practice, unexplained cause of acute kidney failure. And if when you can't find any other cause, and if you ask history of substance abuse, and if they give you a history that they had taken cocaine, then it has been shown that acute kidney injury occurs in persons because of cocaine use, because when there is a very high temperature, hyperthermia, there is a muscle damage. Even the blood vessels of muscles are also, they receive less blood supply and it causes rhabdomyolysis. That itself can cause kidney failure. Then it in turn causes interstitial nephritis. It can cause infarction of kidney tissue. Then it can cause thrombotic microangiopathy, malignant hypertension, and acute interstitial nephritis. Now, all your drugs like Nsaids and cocaine and other recreational drugs, when they cause acute interstitial nephritis, that can be picked up only on kidney biopsy. And it has been shown in some patients that when they when they stop taking the drug, they recover the kidney function. Again, when they take cocaine again, so when they challenge their body with cocaine use again their kidney fails. So there are incidents in literature that repeated cocaine use or exposure would cause kidney damages often on basis, and in the long term will cause chronic kidney damage.
Right. Thank you, doctor. That was a very elaborate answer. In fact, to put it very simply, I'm sure a lot of people might not have understood the implication of all the terminologies of the kidneys that you used. But putting it very simply, it means that what cocaine does is that it constricts the walls of the blood vessels,
Blood vessels.
thereby reducing blood supply to the kidneys and to the different parts of the kidneys, which results in slow damage of the kidneys, of the different various parts of the kidneys, ultimately resulting in failure. At the same time, even one time use of cocaine can result in acute kidney failure, likewise. Also,
Yes.
because cocaine results in muscle damage, which creates toxins in the bloodstream, which also have to pass through the kidney, that also eventually damages the kidney, grossly affecting it and chronically affecting it. So that's what
Yes.
cocaine and other illicit drugs primarily do. Mr. Rajesh Menon has asked a question that, in layman's terms, how much alcohol is damaging to our kidneys? We always thought that liver was the only organ that is damaged and no other organ is affected. So, how much would you say?
So, so liver, as I defined right at the outset of chronic alcoholism, in
Hmm,
males 14 drinks per week, or in females more than 7 drinks per week, we'll call it a chronic alcoholism.
hmm,
Now, per se, liver and alcohol have a direct correlation. That you drink alcohol for so many years and your liver will be damaged. Kidney has indirect effect on the alcohol has indirect effect on the kidney. So alcohol first will cause increase in hypertension. Then with hypertensive medicines also it won't be controlled. And that uncontrolled hypertension for a prolonged period of time will damage your kidney. And then this kidney damage becomes irreversible. Now, alcohol, as I said, alcohol-related liver disease, when it causes kidney failure, then also it becomes a challenging thing to control, and kidneys, you can just go on to dialysis because your liver is also gone and kidney is gone. So if you ask me to measure alcohol and kidney, there is no actual measurement. But yes, liver, yes. But we have observed there's those patients of diabetes and blood pressure who are not coming under control with regular medication or intensification of medication. They reduce alcohol or stop alcohol, the requirement of drugs for blood pressure control and diabetes control goes away, and their kidney, for damage of the kidney, that process is slowed down, and they can live without kidney failure for a prolonged period of time.
Right. So, Mr. Suresh Nair has asked a question, doctor. Thank you for that answer. That sometimes people who use addictive alcohol addictively, we see that they have they present with a swollen face or swelling in the legs, etc. Is it related? Is this presentation related to damage to the kidneys?
So, to be frank, this is more of a liver problem. If you take alcohol for a long time, the liver stops producing albumin. Liver is a major manufacturer of albumin in the body, and your albumin level drops. And when your albumin level drops below 2.5, you start developing hypoproteinemic symptoms. And albumin is a very important component of our blood, which retains fluid in the blood vessels and keeps circulation going. When your albumin is low, the water from is. So this per se is not kidney, but the same patient, when he comes with an acute abuse and goes into kidney failure, this kidney failure is very difficult to correct because the proteins are very low in the body. So a chronic patient with swelling or puffiness of face is because of low albumin. A serious patient after an alcoholic binge and not recovering from kidney failure is because low albumin aggravates your kidney failure, and unless you correct that low albumin, your kidneys would not recover that fast. And it is very easy to say give albumin, but it is such an expensive drug for patients. Those who have to be given for 5 days or 10 days or 20 days, they end up paying through the nose, So mainly the swelling is because of low proteins in the body.
So, doctor, what you're saying is that yes, it's better to prevent the ailment rather than create it. So, one who has an addiction to substances like alcohol, etc., it is better that they seek help, and the families become aware that help is available, that in the form of a residential treatment program whereby they can take care of their health and stop drinking or stop using substances. Now, another thing, doctor, for the understanding of the layperson, how would you say a kidney ailment would present itself in someone who is using alcohol or drugs addictively? How would the family members identify, okay, probably this person's kidneys are getting damaged, I need to take this person to a nephrologist? How would you, could you please share on that?
So, any patient who is on substance abuse or some analgesic abuse or NSAID abuse, or so there are few symptoms the family member should be aware. Anybody who stops eating well, has anorexia, who has a nausea, vomiting, they are losing weight, they are itching, or they are suddenly they develop swelling, puffiness, or breathlessness, or sleeping, then there is something wrong with their kidneys and they are not doing well. It is very easy to diagnose kidney problem, but majority of the time people have a denial. My kidneys are all right, I'm passing urine, but I'm not eating because I took alcohol. I am vomiting because I took alcohol. On that day, if you are vomiting or if you are not eating, it is fine. But if it continues, resulting in loss of weight, weakness, your hemoglobin comes out, then you do your urine routine, do your creatinine, and you do your estimation of GFR, and you immediately come to know that your kidneys are getting affected. And if it is acute or chronic, you do a sonography. Sonography shows a small kidney. That means the damage has been on a chronic basis. And if sonography shows large kidneys, then you have a good chance of recovery if you stop the abuse of offending drug.
So, doctor, summarizing it very importantly is that the people should be aware that if the person is eating less, is losing weight, and is getting breathless, is having nausea, then these indications are probably those of the kidneys getting damaged because of the chronic consumption of the substances that they are
Yeah.
consuming.
Yeah.
So that is very important point to be kept in mind, and I'm
Yeah.
sure a lot of people who are watching us will keep that in mind, because unfortunately what is happening is people are not aware that these organs called as kidneys are extremely important to the human body, and whatever we consume in an addictive proportion will affect it eventually.
So to add to it, 80% of patients will have no symptoms where their kidneys fail for 80%. Only they start understanding where kidneys have the function has come down to less than 20%. So this awareness by the family member about the weight and eating pattern of the patient becomes very crucial at this point. If somebody is smart in the house, okay, yeah, our person is not eating well or losing weight, simple test will immediately lead to them. Okay, oh my God, I have got kidney problem and I have to go to a nephrologist or a physician to address my problem. And the first thing they will be told is to stop their abusing drugs or alcohol or Nsaids or analgesics.
Right, and that is where the unfortunate part happens, is that people who are addicted to the substance do not know how to stop it because they have tried it themselves multiple times, and hence stopping becomes very difficult on their own. That is why they need to seek the help of residential
Rehabilitate.
programs,
Yeah.
rehabilitation programs, through alternate therapies wherein medicines are minimally used or not used or only used for the detoxification period.
Yeah.
So the already presenting damage to the body is limited at the right time. Hence, awareness that such programs are also available is very important for the family to have too. So, doctor, in the current age of fitness, and there's a lot of young people going for gyms and working out, and they want to look good. And especially when they see their idols in the form of stars or sportsmen who are very fit and through different exercise regimes, they also want to look good fast. So they end up using a lot of protein powders. They end up using a lot of sometimes illegally steroid use also. So how would you advise, how can these inappropriately used or misused steroid use or even protein powder use, how does it affect the kidneys? Could you please elaborate?
So kidney is a wonderful organ, it has the ability to take care of any excess till it is functioning well. So in a normal vegetarian person, about 1 gram per kilogram of protein is very well metabolized by the body and reused. Now, in a non-vegetarian patient who eats non-vegetarian on daily basis, the intake will be around 1.2 to 1.3 grams of protein per day, per kg per day. Now, problem comes with people who are, trying to build up their muscles. They end up taking proteins almost to the range of 2 to 2.5 grams per kilogram per body weight. Now, this on a prolonged basis will end up causing damage to the kidneys, especially if you have hypertension or diabetes. Your ability to excrete the bad products of protein metabolism comes down. There is accumulation of urea, creatinine, and other things when you have other associated diseases. So, when a person keeps on taking these excess proteins for a long period of time, they will end up causing, they will end up damaging the kidney by giving more work to the kidney. Whenever you take excess of proteins, there will be proteinuria. Kidney will leak protein, and the afferent vessel of the kidney will be dilated, and that will cause increased intraglomerular pressure, and in long term, it will cause the kidney damage. Now, these people who take a lot of proteins, they are exercising, so they sometimes get joint pains and body aches and other things, and they end up taking either analgesics or NSAIDs also. So, uncontrolled use, unknown use of high protein diet or creatine in powders with these painkiller drugs is a short cause of kidney damage, and long term use can cause kidney failure. But our observation is this is given for 2 or 3 or 6 months only. And if somebody is young and the basic kidney is normal, they will recover from the damage. But middle-aged person who has had hypertension or diabetes, and if they take these proteins with some other drugs, they will have irreversible kidney damage.
Okay. Thank you, doctor. That was very enlightening. In fact, so what you're saying is even if you are young and you are consuming these proteins and also sometimes consuming the NSAIDs, one has to be very careful and very aware of how we go about it. And it has to be done, if required, with the advice of the family physician or a consulting physician, and after checking up one's status of health at any given moment of time.
Yeah.
Without that, one should not indulge in consuming these powders without properly checking if am I healthy enough to consume these in the long term. And
Yeah.
yes, if I have issues like high blood pressure or a cardiac ailment or diabetes, then I have to be doubly careful in consuming these substances and have to do so only after consulting my physician. That
Yeah.
is the highlight of
Yeah.
what you have answered, doctor. That is fantastic. So, a question from our audience, Mrs. Neelam Ramchandani is asking that can kidney pain be felt superficially if one is binge drinking? Okay, or can binge drinking cause kidney pain? And how would we realize?
Yes. So I said that those who take more than 4 drinks on a single night, they can, this is called as binge drinking, and they have multiple etiologies for the pain, you know. One is they are dehydrated and they can cause kidney, and if they have any existing crystalluria or pain, they will definitely develop a precipitation of pain. Second thing is if they have had any fall and any muscle injury, which may be taken up as kidney pain. Third thing is that alcohol itself will cause muscle damage, and those muscle damage mainly would be either in the back, which can present as a kidney pain. So, precipitation of a stone event because of chronic dehydration, muscular injury because of alcohol directly, a fall following a binge drinking, or a hit during binge drinking can cause severe pain in the back, mimicking a kidney pain.
So there are so many things that we are not aware of when one is consuming these substances so freely and so addictively. One does not become aware of these factors. In fact, this information is very important for the families watching this.
Your
Uh,
voice has gone. I
it
can't
will. It
hear
will.
you.
Okay, doctor. It will come. Don't worry about it. It will. It will be audible. It is audible to every. No, you're not be able to hear.
I
It's
can't
okay.
hear you.
You can't hear me. One second. Um, One second. Now, can you hear me now? Hello? One moment, please. Can you hear me now, doctor?
No, not yet.
Not yet. But the audience can hear us. That's I just got a feedback that the audience can hear us. So it's okay, doctor. Not to worry. You will be if you take off you're on mute, doctor. That is probably also. You could unmute yourself. Yeah, great. Now can you hear me?
Yeah, I can hear.
Yeah, perfect, perfect, doctor. So, what I was coming to is that when we use alcohol and other substances so irreverently, and we now understand that it creates so much damage even to the muscles, and I'm sure the families of people who are now viewing us, of people whose loved ones are using substances or using alcohol indiscriminately, will be more aware that even a fall of, because they do fall frequently because of being intoxicated, so even frequent falls can result in muscular damage, which can result in turn in kidney damage. So this is a very moot point of awareness which a lot of people did not have. Thank you, doctor, for this information. Now, doctor, another thing which is very rampant and not so much in our country today, but definitely in USA,
Again,
since
your
we are a
phone.
global platform. Can you hear me? Doctor, am I audible to you? Am I audible to you? I cannot hear you. Um, no, you can't hear me? Hello? Doctor, put on your earphones. Put on your earphones. Connect your earphones to the device. It's okay. We're just having a little glitch. No problem. So we have had a lot of conversations currently. The conversations that we are having, you're not able to hear me. Could you please check your mic? Your mic? I can't hear you. Hello. No, I'm not able to hear you. Can you hear me, doctor? You can hear me, but I am unable to hear you. One second. I'll just, this such a glitch can happen at times. Doctor, you are not audible. That's the, no, you are not audible. No, one moment. Hi. So there's just a small internet glitch till we sort that out. You could we need to understand that Dr. Shah has shared so much with us today, which about topics which we do not think about. Like we as people, even me as a doctor, but as a lay people, my patients or people who come to us or who even families who are watching this would have by now realized how indiscriminately we use medicines like painkillers or even anti-inflammatory medicines, or consume substances like alcohol and drugs, etc., without thinking how much damage these things can cause us. We think that okay, only primarily the organs like the liver is affected, or sometimes it's just muscle damage. I'm having this pain, joint pain, since so many years. I can take painkillers, but and because I need immediate relief from my pain, but without realizing that oh, this is actually damaging my kidneys. And as Dr. Shah said, that kidneys, the damage to the kidneys which happen are, we don't realize it till 80% of the kidneys are damaged. So the ideal situation is that, so by the time we realize that our kidneys are damaged, it is already too late, or one might require lifetime treatment through medications or dialysis, etc. So another multiple points that he has shared is that we need to be aware that even mild weight loss, or we see changes in habits of eating habits of our loved ones who we know are ingesting alcohol and drugs very indiscriminately in quantums that they should not be using. And the thing is that what can be done is they don't understand that, okay, such indiscriminate use is happening. But that is where it is required to understand that your loved one requires help, requires residential care, requires the care wherein they receive the right kind of help that is required, because they have been trying to use substances socially, as a social user, consuming alcohol as a social drinker, but they have failed multiple times. They have tried to stop on their own multiple times. However, one needs to understand that where addiction is concerned, the issue is not the substance. The substance use is only a symptom of a deeper emotional issue. And that is what requires treatment. So, in treatment, we are not treating the substance, mind you, we are treating the individual who is using that substance addictively. So, in that process, we have a residential program wherein we live with the counselors. You are still not audible, doctor. So we live with the clients, with our clients. So the client lives with the counselors who are experienced. By experienced counselors, we mean those who have in their life been addicted to substances and have taken treatment for their addictive nature, and today are living fulfilling lives, happy and joyful lives, away from their substances, not finding the need to drink or use drugs. So to reach what they have attained becomes a very inspirational and motivating factor for those who are currently using substances addictively. So that is wherein the family comes in. The family comes in and they uh, connect with us, like, because it's always the family that is seeing their loved one suffering so much and they want to seek help in any which way. So you need to understand that help is available, and the right kind of help is a system which takes in the client voluntarily, not against his will, but with his will and with his consent, his or her consent. And that is the only way where the treatment works. And the program should involve eclectic counseling methodologies and even meditation processes. Like we at Anatta have these programs and these processes wherein we use eclectic counseling techniques. We have various meditation techniques which helps the person remain in the present and helps the person resolve one's issues. Sharing that happens anytime in a space of 24/7 is available to the client. We live with the client, hence we are available to the client. So it can be any time in the day or night. If someone requires help, we are available to speak to share with, and etc. And the thing is that detoxification is the initial part of our treatment process, wherein the person coming to us will need to stop the substances of abuse, and that result and that medications need to be given for some time. So that is how we come forth and begin the treatment. So medications are given only to tide over the withdrawals. After that, we discontinue those medicines. Hello, doctor. Welcome back.
Sorry.
You are still not audible, doctor, unfortunately.
Because
Uh,
both
now you are.
unmuted.
Now you are audible. I can hear you. Please connect
Yeah, okay.
your earpiece.
Can you hear me?
Yes, I can. You've again frozen,
Can you
but a
hear me
little
or
bit.
not? Yeah.
I can hear
Yeah.
you, doctor. I can hear you.
Yeah.
Now I'm
Yeah,
audible to
okay.
you?
Okay.
Oh,
Okay.
fantastic, fantastic,
Yeah,
fantastic, doctor.
yeah. You are
Welcome
audible.
back.
Yeah.
Welcome back. No issues, no issues. Such things happen on a live show. No problem.
Yeah. Yeah.
Yes, doctor. Yeah, so
Yeah.
coming back
Yeah.
to you, I would like to ask you one thing, that in your experience, in your clinical practice, how have you identified that this patient of yours is probably addictively using alcohol or addictively using a substance? How would you have, like, it's like a reverse diagnosis, like reverse arrival at a cause. Like even when you ask a direct question like, are you using any substances, the person does not tell you the truth. So then in such situations, how do you determine that, okay, this is definitely substance use talking to me in the form of the presenting symptoms? How would you elaborate, come up to that?
So this is the most difficult task, because there are no definitive tests to determine your kidney damage is because of alcohol or because of a given drug. So at that point, the history taking becomes very challenging. Now, somebody who's, suppose if you've taken binge of alcohol, your kidney function is poor after taking alcohol or taking dose of cocaine or some drug, and your creatinine goes up or your urine output drops. That means that this is related to your alcohol abuse or a drug abuse. But there are no biochemical markers from where you can make out that your kidney is affected because you have taken alcohol or a drug yesterday. Only in cases of acute renal failure, when you do the kidney biopsy, then you know that there is inflammation in the interstitium and in the tubules, and that is the cause of your kidney failure following your abuse of the drugs or alcohol. And when you stop it, the patient's kidney function recovers. But there is no marker to suggest that your kidneys have failed because of either alcohol or the drugs or because of Nsaids.
All right. Thank you, doctor. That was quite a revelation. So, in you might have come across, okay, a person who is addicted to a substance and is becoming, the family brings the person to you and tells you, this person is drinking too much or is using so and so drugs. So, have you had the experience of motivating such a client to accept help?
So here the role of counselor comes into play.
Yes.
Counselor, rehabilitation experts, and support of the family members. Here, actually, drug-wise, there is hardly anything you can offer it except to scare him. That if you continue to take, we take them for a journey to our dialysis unit and tell them, "Okay, if you continue to take your alcohol or cocaine or some NSAID drugs or analgesic drug, you will end up on dialysis." And those patients who are sane, those who have some intelligence, they will understand it very quickly and they will stop taking their abusing drugs or alcohol. And we take help of psychologists, psychiatrists, rehabilitation centers, and de-addiction program people to take care of these patients. And with joint consultation with them, you can offer a great help to these patients and you can turn them around.
Fantastic, doctor. That is so nice to know that you motivate the client to receive the right help in the form of adopting rehabilitation procedures. Because, doctor, in my experience in this field, we have seen that fear has a very short lifespan. So, even fear of
And
death, or fear that I will suffer, does not work where addiction is concerned. So, meeting the right people, as you said, consulting the psychologists or even experiential counselors in the field, helps the person to receive inspiration and motivation to seek the right kind of help. And we at Anatta provide that help, including not only to the person suffering, but also to the family through our family therapy systems, which work parallelly with our residential systems also. And we provide single care to the client. So we have a single client program in destinations of their choice, which are mutually decided, so that they have the time and space to focus on themselves and assume responsibility of themselves and their use, thereby seeking help, thereby not finding the need to use in the future. So, doctor, another question that comes to mind is that in the Western countries, that there have been a lot of. Okay, we have a question from one of our audience. I'll come to my question later, doctor. Dr. Jagruti Kamdar says that I'm a palliative care physician and we use a lot of morphine to help our patients remain pain free. Is morphine a safe drug to use where kidneys are concerned, or is there any other drug that can be used safely?
so the answer is very simple. Morphine is used for end of care patients where you
Yes.
have to, you are not worried about length of survival or life. Here you are more worried about giving pain-free a few days to the patient. And morphine per se would not cause kidney damage, but it will cause a lot of sedation, and patients who cannot inform their family or relatives about side effects of sedation or respiratory problem, then it can cause subsequent chest infection and then leading to some electrolyte imbalance and the kidney damage. But per se, morphine is always given for patients who are not likely to survive, are in extreme pain, and the relief of pain is the first priority, and it is a very safe drug as compared to your Nsaids or analgesics in the end of care life support.
Right. Yes, doctor. Thank you for that answer. Uh, Coming back to my question was that in the Western countries, especially America, they are seeing a rise in, and it is really an epidemic proportion of opioid addiction use, of opioid prescription medication addiction use. So, how would you comment on that, and how would that be damaging to the kidneys in the long run? Indiscriminate opioid medication use. If you could please
Now,
elaborate on
the
that.
biggest derivative which is used in Western countries is heroin. Now, heroin, when they take on a long-term basis, and the patients, when they have acute damage, they develop increased temperature, hyperthermia, and that can cause muscle damage, causing rhabdomyolysis. They can also develop high blood pressure, they can develop stroke. And in kidneys, it can cause glomerular disease, interstitial disease, and it can affect the vessels of the kidney, the capillaries. In kidneys, they can produce acute kidney injury in the form of acute tubular necrosis, acute interstitial nephritis, thrombotic microangiopathies, and crystal nephropathy. So, this opioid use can cause your crystal nephropathy, the stone nephropathy. Then that they can also present as nephritic syndrome in the form of immune complex diseases. They can present as nephrotic syndrome in the form of FSCS and amyloidosis, and they can present as chronic kidney disease with amyloid or FSCS and chronic interstitial nephritis. Now, this problem is more with patients who are chronically heroin user, and they do come out with a lot of kidney damage. And if they don't take time,
Doctor, you have gone mute. You will need to unmute yourself. Yes. No, you're getting. Yes.
yeah.
Okay. Okay. So what you're saying is
Hello,
that yes, I can hear you, doctor. So indiscriminate opioid use, not just heroin or brown sugar use, but also medication,
hello,
opioid. Hello. But also opioid medication can result in these problems.
hello. Yes, 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 yes.
Yes,
By all
right.
means.
Yes. So
Yeah.
So, Doctor, now coming to the end of our program, what I would also like to ask you is what is your message to people who are using alcohol and drugs indiscriminately out there? What would your message be to those people in motivating them to accept help?
So the youngsters who are into this alcohol and the drugs which are addicting them, my advice to them is alcohol, heroin, cocaine, analgesics, and anti-inflammatory drugs are not your life. You have many other things to do in life. If you take care of your important organs like brain, heart, lungs, liver, and kidney, you can live healthy life of 70, 80, 90 years. And it is the formative young age where if you correct your all the addictions and lead a healthy life with the help of palliative care or psychologists or a de-addiction center. I have seen so many people turning themselves into a counselor and helping other patients. So please don't remain in denial. Take a good support from people available in the society, and your doctor is always there to help you out with your medical things. But this de-addiction program or to take you away from the drug is a job of people who persist in it and who guide you properly, who make you meet in a group, who will discuss the problems in collectively, and help you to come out of addiction easily.
Thank you, Doctor. Thank you, Dr. Shah. So that was Dr. Shah helping us and guiding us through various ways in which our kidneys can be affected by indiscriminate use of alcohol and drugs. So, what is more important, the message is very clear. It is about not the number of years that you live, but adding life to those years by choosing the right things, by making the right choices. And drugs and alcohol, indiscriminate use, are not the right choices for you. However, if you are already addicted to the substances, then definitely seek help. And for the families out there, please understand that help is available for your loved one. All it takes is to pick up the phone and call, and there is somebody on the opposite side who understands what you're going through and who can provide you with the right solutions. Thank you very much, Dr. Shah, for joining us today and being with us and spending time with us.
Yeah.
I hope you had a good time too.
Thank you. Thank
All right.
Yep.